Restart the recording now. And hopefully that gives everybody a little clue into where we're headed. And now I would like to introduce Dr. Irene Prabhudas. She comes from the public health arena as originally an epidemiologist in Los Angeles at UCLA, and then moved on to University of South Carolina, where she obtained her PhD focusing on cancer detection, which took her to the National Cancer Institute, a part of the National Institutes of Health. From there, she has joined the Office of the Director of the National Institutes of Health as a health scientist administrator and program director within the Division of Cohort Development of the All of Us research program. Dr. Prabhudas is currently the lead on the survey completion pilot project that tested interventions for enhancing participant response to program surveys, and also on the All of Us enrollment infrastructure characterization project that defines, maps, and describes the landscape of both enrollment streams of healthcare provider organizations and direct volunteers, where we're looking to engage you. After obtaining her PhD, she served as the public health advisor and health scientist at the Office of Dissemination and Implementation and Healthcare Delivery Research Program within the National Cancer Institute at the NIH, where her research activities spanned across program evaluation, multi-level interventions, qualitative research, and multidisciplinary cancer care. Just giving all of you a little sense of Dr. Prabhudas's successes and what informs her to be able to speak to us about the All of Us program. So warm welcome to Dr. Prabhudas, and we'll bring up her slides.
Great. Thank you so much, Pavan, for your introduction. Can you hear me?
Yes, just perfect.
Okay. All right. Good morning, everyone. I really am very honored to be invited here to join you this morning to share with you about the All of Us research program. And on behalf of the National Institutes of Health, I would like to take this opportunity to welcome the Jain Society of Metropolitan Washington as our newest community partner as part of the Community Provider and Gateway Initiative. I understand that your recent newsletter actually provided some information about the All of Us research program, and I am just glad to be here to be able to add to what you have already started here. Let me just begin by sharing a little bit about who I am. I was born in India, specifically in Madras, which is now called Chennai, but I didn't live in India, so to speak, because I left India when I was 1.5 and lived in Malaysia and Singapore before I came to the US. But in my growing up years and learning in Malaysia and Singapore, I was actually very privileged to grow up in a very diverse community, diverse by way of language, culture, religions, ethnic groups. And that was a wonderful experience because you get to participate in food, which is always good, language and culture. But more importantly, the fact that I've been in a diverse background, I come from a diverse environment, I have benefited from diverse experiences. This is a very natural fit for me to be a part of the All of Us research program, aligning who I am with the values of this program, which you're going to hear a little bit more as we get into this talk. So next slide, please. The poll that you just took kind of touched on what is precision medicine, if you've heard about it, and whether you'd even like to participate in research. So I'm hoping to at least address some of these items here in this talk with you today. So what is precision medicine, right? So a number of us may have heard this term, some of us even know about it, but essentially it's really an approach to how we treat disease as well as prevent it. But what it really takes into account is the fact that there are individual uniqueness and how should I say it, like factors, if you will, that come into play that have to inform how disease is treated and prevented. And so we want to take into account lifestyle, socioeconomics, biology, our DNA composition, et cetera, and even the environment in which we live, so that we can learn about diseases in context of the individuals who are experiencing them. And so this is a whole radical shift in research in particular. And this is how we can learn from research in order to be able to develop and then deliver the best care possible based on who we are and where we live. So next slide, please. And in particular now, what is the All of Us research program? So our director, Dr. Francis Collins, whom you may have heard and even seen on national TV, considers, and he actually is the person behind the All of Us research program, actually calls this program among the most ambitious research efforts that the US has actually conducted. Why is it so ambitious? Because they're trying to reach and include at least 1 million people who are living in the United States to make up this diverse health database that is representative of everyone in this country. And by diverse, it's like I mentioned, it's in all aspects of life: environment, circumstances, lifestyles, biology, diet even, and health history. And so the goal is to be able to develop individualized approaches and treatments that will be applicable to all of us. So next slide. So several core values actually guide this program. It's open to everyone. It is going to be reflecting the rich diversity, and you'll also hear a little bit of what we have right now. And participants are partners, and a very key aspect of our values is transparency, as well as privacy and security. And most of all, we want this program to be a catalyst to be a positive change in research. Next slide, please. So in what way is All of Us actually different? And there are 4 different ways in here that I'll just briefly touch on. And just to let you know, these slides will be made available. So in case I skip over a few slides, you will have this information at your fingertips if you needed to. So we want to make sure that this program is not only going to be addressing one particular disease or a health condition. That's the reason for the diverse health database. We want to be able to be a national research resource that can inform multiple studies and different types of studies that will cover different types of health conditions. And the breadth of this program, while it is looking at a number here of 1 million or more, what we want to make sure is that we want to understand the volume of data, that as it grows, we will begin to see patterns that you may not necessarily see in a focused single study or a focused set of studies. Then diversity, which is a major, and I would say front and center of this program, is the other way in which this program is different. And in a slide that you'll see in a little bit, I will go into a little bit more about what we mean by diversity and how diversity is actually being represented. And then, of course, engagement. We don't want people who participate in this research program to be simply participants or simply research subjects. The perspective that we've taken towards participation is partnership. And so when people begin to enroll into this program, they now become partners in this program because we seek out information, input, even reviews of materials, of approaches from the participants in the program. So people have a say in how things are being developed, the types of things that go into the material as well. Next slide, please. So, as I mentioned earlier, diversity is a core value here. And how are we attempting to reach this goal, if you will? We are diverse in our demographics. By that we mean it's not just age or gender, it's also in areas that you live, which is in urban rural, which is in the geography. There is also the demographics with regard to socioeconomic status. And on the right side, you see demographics, or I should say descriptors in health status. And by that we mean we are seeking to bring in people who are not only healthy or not only sick or only have certain types of conditions. So we have a breadth of different types of health status conditions, if you will. Well, maybe even sick, or maybe chronically ill, disabled, everything we want to be able to be diverse about. And then we also have diverse data types, which we'll hear about in the next slide. Next, please. So why is it important to even consider participating, especially as we're here gathered together as a Jain society here? So a few statistics here that kind of maybe help set the picture a little bit and help to guide our understanding. Nationally, in the US, about 38% comprise minorities or ethnic minorities. They project this percentage to increase to over half of the population. On the right side, what you see is a bit more specifics with regard to the types of ethnic minorities. But I want to draw your attention to the last group that is there, which is the Asian American, Native Hawaiian, and Pacific Islander population that currently comprise about 6% of the US population. And only 1% of them actually participate in these NIH clinical trials research. But if you notice, right, that is a big category here, Asian American, Native Hawaiian, Pacific Islanders. Very rarely do we have data that takes it even further down by the different sectors of Asian Americans. So I've put in a little statistic below here about nearly 5.6 million South Asians, of which we're a part, live here in the US. And this group of us has been identified as the fastest growing subgroup within the United States. And from all of this so far, you'll see that the percentage of involvement with the other ethnic groups plus ours as Asians is very low. All right, so next slide, please. I'd like to share with you some specific data about the All of Us program in particular. So to date, as of, I would say even this week, we have been able to enroll over 380,000 individuals across the United States. And 80% of those that have been enrolled actually belong to one of the historically underrepresented groups in biomedical research. So that would mean older adults, racial ethnic minorities, disabled, different gender and lifestyle experiences, and language groups. I've missed a couple more, but I just wanted to give you a flavor of the different types of the groups that are in the underrepresented in biomedical research. And more than 52% really are in racial ethnic minority groups. Next slide, please. More specifically, of those that have been enrolled, so of the 380,000 individuals that have been enrolled, only 3% identify themselves as Asian. And remember, I mentioned Asian, right? So it's a larger group here. And more than 57% are women. And from an age breakdown, what you see here on the right, the top three categories refer to the age group of 18 to 44, which is generally, I would say, a younger group. More than half of the enrolled population falls under the younger population. And fewer in comparison are in the older population. Now, less than 1% of those individuals who completed demographic surveys when they enrolled in the program self-identified as being Asian Indian. So just to give you a flavor here, that it's very few of us as Asian Indians that are participating and taking the opportunity to be able to communicate as well as contribute to the larger enterprise here. So next slide, please. Why bother participating? What's the value? What's the benefit? So the first thing that you see on the left here is by participating in the All of Us program, we can enable our respective communities to be able to be represented in medical research that is coming down the line. Now, as I mentioned earlier, being that it's precision medicine, which means we're trying to develop individualized treatments and approaches, we want to make sure that it's not just clinical research, because that is why we're collecting other data as well. Your environmental data, your lifestyle data, your diet data, your behavioral health data. So it gives us the opportunity to participate and be represented in broad areas of research. And secondly, what we want to see is that these different data can be used to improve clinicians as well as researchers' understanding of disease, especially now in an era where we are getting in this pandemic. And we've also heard a lot about rare diseases. It's more important than ever to be able to learn from people themselves and to understand what may be occurring in our respective lives, in our exposures, et cetera, that may be contributing to these various types of diseases and conditions. And finally, on the right there, we want to be able to provide the opportunity for people to participate in other research opportunities that can come up as a result of being in the All of Us research program. Next slide, please. So there are different activities that participants will engage in when they enroll into the program. And as a quick overview from the left, moving to the right, the first thing, of course, before you can even begin contributing data, we want to make sure that you agree to what is being asked of you. One of the things is whether you would be willing to share your electronic health records. If you wish not to do that, it doesn't mean you cannot participate. You still can participate. So that under the consent on the first box on the left, you would be able to provide the authorization to share your electronic health data or not, but you can still participate. Then another way you will participate is by answering surveys. So right now we have about 6 surveys, and the first 3 that are listed there on overall health basics as well as lifestyle essentially are done at the time when the participant is enrolled. And then the remaining 3 are done after that at your own pace, if you would like. And even if you need help, we have now an opportunity to work with you all to find out how we might be able to help access these surveys for you all to be part of that. And then we have more surveys coming down the line. And this again will provide more individualized contextual data. In addition to that, we are collecting biosamples, physical measurements, and one thing we just newly added is about this wearable, a device. And many of you would have heard of the Fitbit, which is the exercise device. And they've just started it within the past year or so to be able to collect data from that. And pilots are constantly under development right now because we want to be able to respond to what's coming down technologically, as well as what's available for data to be shared as well. Next slide, please.
So Irene, I'm sorry, but we're kind of running short on time.
Okay.
And so I just wanted to give the chance to Rahul to speak a few minutes because we do have another program, the big COVID fundraising event for India at 11. And I want to be able to hopefully give you folks a little bit of a break. So if it's okay, we'll pause on the slides, let Rahul speak, and then maybe catch some questions.
Sure.
So just want to introduce Rahul Jain. You guys, many of you know him, and he's the one who's actually brought us to the All of Us program. And Rahul, take it away.
Hi, JSMW everyone. Good morning. Funny when Pawan asked me to share my experience about All of Us research here. I went back and looked at when I enrolled in the program. I enrolled on June 11th. And then I was just June 11, 2018, by the way. And I was curious, when did the program actually launch? The program launched a month before I enrolled. So you can call me an early adopter. And now I've turned into an evangelist for the program. I truly believe in it. I distinctly remember that one thing was bothering me when I enrolled in the program, and I was unsure. Now, at that time, I had been working in the health industry with Blue Cross Blue Shield for about 13 years. And health data privacy concern is top of mind. So I remember, how secure will my data be? I'm sharing my health data in this program, and that was top of mind for me. So I remember doing a little bit of research. So for those of you who may be thinking of joining the program, haven't joined, are on the fence, thinking about privacy and security, for what it's worth, I did my research and I felt safe enrolling myself into the program. Just from experience perspective, before COVID hit, the program was, I looked back and looked at the data that I submitted. It was more about physical health, socioeconomic data that the program had gathered. And then since COVID has hit, it has turned into more of a mental health evaluation, the surveys that I've taken. It has been pretty easy to enroll. It was very easy to enroll. It has been very easy to provide data through a mobile app. I rarely go onto the website, and I've been able to engage with the program all through my mobile app. Very recently, I provided my DNA through a saliva test that I submitted very recently. And one last thing I will share is the data that the program has collected about me. They make it available very easily through, you can download it or look at it online. And I find that comforting that it's my data. I have it available at my fingertips, and with a single click of a button, I can erase all of the data as well and take it out of the program as well. So I find it very comforting to know that I'm in control here about my data, because that's top of my mind for me. And if you're on the fence and have more questions, I'm certainly happy to answer, having participated in the program for a couple of years now. Pawan, back to you.
Excellent. So thank you very much. And I also wanted to note to the folks in the Jain Society, some of you have heard this and some of you have not. So through the partnership that we've developed with the All of Us program, first a big thanks to Wendy Bhagat and Rima Matsumoto, who have been our engagement counselors through the Pyxis Partners program to get us set up to have been granted the $75,000 that have been able to help support a lot of our programs and a lot of our opportunities to disseminate information about the All of Us research program, with the end goal in mind to communicate to you, our members, and get you to sign up, and all of your members in your family, your parents, your adult children above 18, all are welcome to sign up. And I was just speaking with my mother this morning and I said, I need to sign you two up as well, and my wife. And so definitely need to continue to spread that and work on that. And also a big thanks to Dr. Prabhudas for joining us. And I'm happy to take any questions if you guys want to. And then finally, I remember one more big thank you. The actual lead in our Jain Society for this is Pulkit Gangwal, who is our Director of Public Relations, and he has done the lion's share of work in putting together the statement of work, maintaining our monthly reports, attending a number of webinars and seminars that the All of Us Community Partner Gateway Initiative and the All of Us program have put together. And so a huge thanks to Pulkit as well. But if you guys have any questions, all of us are available to answer them. And you will hear, as Wendy and I both were reflecting, in a lot of our terms when we talk about this, those words, all of us, keep coming up in everything that we say. And it just becomes a natural part, how we want to bring everybody together. In addition, in the chat, I put a brief post survey if a few of you or all of you would be willing to take it. It's only about 8 to 10 questions just to get a sense about the utility of this kind of program. Obviously, in person, we would be able to definitely have much more engagement, and this would have been a perfect parallel to Pachala program in our wellness series, but obviously things are a little different right now. Hopefully we'll be given back to soon in person, maybe within the next year, and go from there. Mina, I appreciate your question. If you enroll the whole family, do you have to create separate accounts for everyone? Irene is nodding her head.
Yes, that is correct, because each individual is a participant. So you would have to, yes.
Yeah,
So everybody will be required to have a email account then, is what you're saying? Or can we use the same email account?
Probably not the same email account, but yes, it has to be a separate email account as well. If emails are not there, I believe even cell phone numbers now are another way.
Okay.
As well. Yeah.
Okay, thank you.
And truly, as Rahul commented, using the app, if each of you to your smartphone downloads the app, it makes the whole process very smooth, very easy. It just, when the survey comes in, just pops up, please complete the survey, you go through it, 10 to 20 questions, and you're done within a few minutes. I mean, truly the effort for this is very minimal. And the folks at the NIH and the All of Us research program have made it really easy for all of us to participate. And just to be clear, this is not just for US citizens or green card holders, but anyone who is in the United States at this time is welcome to participate. And there's no looking at, not that this is generally a concern for folks in our group, no looking at immigration status or anything like that. It's truly about engaging you to get your health data. And just to relate it to the earlier talk, right? So most research nowadays, or historically, has been for this disease process, this university is capturing people. This disease process or this vaccine, right? Like the COVID-19 vaccine, you have to engage individually, reach out to a university or a hospital to get engaged. This is where this program has really turned it on its head, and it is open for everybody. And you just go to joinallofus.org/go, as Rima has just put in the chat, and it's very easy to sign up. So thank you very much to everybody. And I really appreciate it. And I hope that everyone does go over to the next Zoom. I know it's a lot of Zoom in the morning, but it is going to be a wonderful Manglik Pravachan, as well as some speeches as we try to raise funds for our Sadharmic Bhakti families in India as they're suffering through this true crisis, as even Dr. Kaushal and Gitanti have shared at the beginning of the program.
Well, thank you everyone for joining, and we will be having more sessions as such, and ready for the next session now. Thank you.
Thank you so much.